Good afternoon. On behalf of the team and social marketing company, I am Moshiur Rahman is going to present the paper titled Role of Private Sector Providers in Distributing Family Planning Methods in Bangladesh Using Social Marketing Approach. Social marketing company, SMC, is playing a significant role in the National Health and Family Planning Program of Bangladesh, and its overall mission is to improve the health and well-being of women, children, and families through applying social marketing techniques and by marketing public health products and services in partnership with government, development partners, and the private sector. SMC started its journey in 1974 and continued till 1990 as a family planning social marketing project that was set up by an INGO, US-based INGO, Population Services International, with USAID funding. And SMC started marketing with USAID donated oral contraceptive pills and condoms at very low prices. And social marketing company was formed in 1990 and it has become the non-profit private limited entity with a voluntary board in 1990. And in 1997, SMC has become the direct recipient of USAID funds. And in 2014, SMC formed a for-profit subsidiary, SMC Enterprise. The main thrust of forming this SMC Enterprise is to making profit by selling the public health products so that a part of the profit can be expensed for expanding the business of SMC Enterprise and other part of the profit can be plowed back to continue the program operations of parent organization. It's a part of the making the SMC sustainable. Currently, 38% of national contraceptive prevalence rate share is coming from SMC, and it has become the second largest contraceptive social marketing program globally in terms of couple years protection delivered. And SMC is now enjoying 61% market share of oral rehydration salt. And due to this oral rehydration salt, the childhood diarrhea, once upon a time, it was the number one killer of under 5 children, and now it has become the sixth number of death of under 5 children. And 44% of childhood diarrhea treated combined with the zinc and worries. And SMC few years back has started to market sanitary napkin at affordable prices. In fact, with aim to ensure the use of sanitary napkin by the rural women or rural adolescents. And at this point, this sanitary napkin has become the second highest popular brand in the country. This diagram shows the SMC's contribution to the National Family Planning Program. As I mentioned, 38% modern contraceptive method users rely on SMC brands. 62% use SMC brands of condoms. 47% use SMC pills. And 33% use different brands of SMC injectables. And 6% IUD administration in the national program by the different star network members of SMC. This slide shows the different brands of condoms, oral contraceptive pills, and injectables. As you can see, there are 13 brands of condoms. So some of the brands is marketed to capture the lower segment of population. Some are to capture the upper segment of population and also the middle class. So SMC is marketing different brands of condom to target the different segment of population, and the price point is also different but ensuring the quality. So we are making profit by selling the premium brands, condom, pill or injectables, and then we are also marketing subsidized condom pills so that the lower segment of population easily can afford and they can use the SMC branded condoms, pills and injectables. So SMC is now playing with the private sector providers. SMC has become a successful private sector social marketing program in the health and family planning globally, and it has regarded as one of the most successful investment of USAID in the health sector. The network providers offer affordable services to the target population by increasing awareness and accessibility of different public health products and services from their service delivery center. These private sector providers are selected using a set of criteria, and different screening process is done by the field level staff. So one of the STAR network program is the Blue Star program. It's a non-graduate health providers network. Currently 9,500 non-graduate health providers are included or involved in this network. And this network started its journey in 1998. And initially, it started journey to offer the contraceptive injectables with some public health priority services. This program is being implemented in close collaboration with the government, the Director General of Family Planning, with financial assistance from USAID. And the main objective of the program is to train and motivate private non-graduate health providers who are working in the community to become proactive supporters of public health products and services in their community, and to increase awareness, access and utilization of public health products and services. So this network, basically they sit in a chamber attached with a pharmacy, so they can provide the quality services by ensuring the privacy. So there are another network program, it's called Green Star program. It's a network of 4,500 pharmacy and public health product sellers. They offer follow-up injectable services. As I said that there are 9,500 Blue Star providers. They are spread over across the whole country, but there are still few areas where women need to travel more. So we have created this network so that once they receive the services or injectable services from the Blue Star network, they can easily visit this Green Star provider to receive the follow-up injectable doses. And they are proactively counseling the clients about the nutrition. And this network has started its journey in 2018. And they are the primary contact point for community members, and they provide over-the-counter general health and family planning information and services. This program also is being implemented in close collaboration with the government of Bangladesh with financial assistance from USAID. We have another program that is called Gold Star program. This is a network of around 3,000 women entrepreneurs, and they are working under the community mobilization activities of SMC. It started its journey in 2013. Currently, SMC is implementing community mobilization activities in 93 sub-districts where these Gold Star members or these women entrepreneurs are working in their communities. The objective of forming this women entrepreneur or Gold Star member to create and sustain the demand for and supply of public health products or commodities in their community. They usually conduct different courtier sessions in their community and orient the people about different public health products and services, and also they visit the households to make the products available at doorstep. This model also aims to increasing women's empowerment in the community. The major target group of the program is married women of reproductive age and their husbands, adolescents and under 5 children who resides in the catchment area of these private sector providers. And majority of the providers are the male, aged between 36 to 45 years. On an average, they attend more than 30 clients from their chamber or from their outlet in a single day. Usually the providers, they offer the family planning methods with a special focus on injectables, different family planning counseling on different methods, nutrition counseling. They offer the growth monitoring and promotion services to the under 5-year children. They offer the pregnancy care services, different basic services to the pregnant women, and refer suspected TB cases, children with severe pneumonia and malnourished children, and long-acting and reversible or permanent family planning clients to the nearest service delivery center. What basically SMC does? SMC provides basic training. It's a 3 days package covering different priority public health issues and services these providers need to offer in their community. They receive counseling skills, compliances, different compliances issues, and the reporting processes. And the basic training is jointly organized by the government of Bangladesh and SMC. And only the successful participants who complete the 3 days course, basic orientation or training, they receive a certificate that is jointly signed by the Director General of Family Planning and SMC. These providers also receive periodical refresher training to update their knowledge and build their capacity further. SMC provides on-site technical assistance by involving different field staff located at different parts of the country, as the provider is spread over the whole country. So our field staff is also working across the whole country. So SMC also conducts monitoring visit by involving the quality assurance team led by a medical background staff or physicians. So SMC performs data quality assessment by the head office team, and we ensure quality services by sending monthly performance report using mobile application. And also we share best practices of the providers through workshop and meeting. We organize different performance sharing meeting at regional level so that the providers get the opportunity to share their best practices and experiences in that workshop. And in addition, we also share a newsletter with the providers where different best practices and different stories are highlighted so that these providers can learn from others' experiences. So not only giving the trainings, SMC also involved in promoting their outlets or promoting the different star network providers. SMC promotes their outlets and the network through comprehensive demand creation activities by using both local and mass media. The outlet of this star network is branded with a signboard. They also receive apron, curtain, and posters regarding different compliances, infection prevention, and waste disposal, and essential product details so that they can provide the quality services. In addition, we distribute leaflet to the outlets so that the provider can distribute among the clients. A loudspeaker announcement is done to orient these providers in the community as the different star network providers, and mass media such as print media, radio and TV commercials, and online platforms are used to promote the different star network providers. So if we see the annual performance, especially the last year performance, we can see that 4.57 million vials of injectable contraceptives are administered by these star network providers, and around 50 million oral contraceptive pills used by the clients, and 163 million condoms used by the clients, and 164,000 potential long-acting and permanent method clients are referred to the designated health facility by these star network providers. So what are the benefits the customers are getting from this program? They can easily access to health services in low-performing underserved areas, more women and children-friendly service delivery outlets in the community, and clients can easily get services at affordable prices from this outlet, and it has become the sustainable source of family planning and health services at the community level. As you know, these star network providers, they are the entrepreneurs, and they have established their business center by their own initiative, and only SMC is building their capacity, giving the training, improving their service quality, and also promoting these outlets so that the people can visit these outlets and get the quality services, and ultimately this provider will be benefited. And why this has become the sustainable, if you see, during the COVID period, these providers, they continued their services, and due to their continuation of services and getting the uninterrupted contraceptive supplies by SNC, during the COVID period, the sales of contraceptive injectables has increased 70% over the last 2 years. And it became probably due to the public health sector field workers or providers and the other different hospitals or clinics, NGOs. Many of the providers or field workers, they were reluctant to provide the services during the COVID period. But these providers, they continued their services in the community, so that they have become more trusted provider in their community among the community people. So what kinds of benefits the provider is getting? It has created a greater acceptance in their community. It helped to improve their skills due to continuous training, increase their image at the community level. 8 out of 10 clients perceive that Blue Star providers provide better healthcare services. And 95% providers mentioned that their income has increased due to become a member of this network. So we can see that not only the community people, but the provider also have become the benefited to become part of this network, or become the member of this network. So it's a both win-win situation for the consumers and the provider level. So what we have learned from these experiences, we learned that the private non-graduate health providers can play a vital role to contribute in the national health and family planning programs. And capacity building through training or continuous monitoring are really essential to ensure the quality of services by these network members. And providing required equipments and promotion of outlets as a service delivery point to increase acceptance in the community, as they are providing quality services with adequate equipment, and SMC is promoting. So already the people have a trust with SMC, and they also believe the SMC operated start network, they will also provide quality services, and they're visiting and ultimately getting the quality services, and they are ensuring the repeat visits. And as a result, the business of the star network providers are increasing. So establishing quality assurance system is also essential to make the network successful. As I said, that ultimately the main issue is to offer the quality services. As the star network members, they are improving their quality and offering the quality service in the community. Ultimately, they are becoming different from other non-graduate providers. So in the concluding remarks, we can say the program opens up a new avenue to increase access to and the demand for family planning commodities in the community level. Involvement of community level private healthcare providers is very instrumental to improve access and the availability of private family planning products and services. And SMC has become a successful private sector social marketing program in family planning by offering a full range of family planning commodities and increasing health awareness through private sector providers. So we can easily see that the role of private sector is really critical to provide a quality services and to increase or enhance the access of services at the rural and both urban areas. Thank you. Thank you so much.